is American Heart Month, and Not on Your Side is joining to raise awareness about heart health. We are joined by Dr. Courtney Saunders, who's a cardiologist at East Carolina Heart Institute at Vidant Medical Center. So explain your role as an advanced heart failure cardiologist.
So what I do is take care of patients with advanced disease, oftentimes suffering complications of the things we hear about, high blood pressure, high cholesterol, diabetes. So I help take care of those patients and do things like try to extend their life when we know it's going to be shorter. Things that we have been doing lately at our hospital are we have advanced our program into implanting left ventricular support devices.
Wow.
Yeah, it's very neat because it gets patients back to doing what they used to be able to do.
Exactly.
Even though it's a major surgery and a major life change. So we get to have some fun taking care of those folks.
Yeah, I'm sure it's very worth it to them. So how can patients help their providers help them essentially?
So I think the biggest thing when patients come to see us, I think it's really interesting. We go in focused on what is actually going on with the patient and thinking about the science. And of course, we're worried about what's going on that's helping them meet their goals in terms of their health. And I think a patient can bring that with them. Jot down a few notes. It's okay to bring us a couple of items that you want to discuss.
Yeah.
And be prepared to have information for us, such as what medicines you're taking, how you're taking them.
Yeah.
And be unafraid to ask.
Yeah.
We're there to help you. And so if we're not doing a good job of answering questions for you, you need to stop us and say, hey, I don't get this. So that we can try to clarify for you what's going on, because if we're not a team, it doesn't really work out too well.
Right. So what ways can they facilitate a healthy doctor-patient relationship? You mentioned some, but I'm sure there's endless.
Right. So being very candid in your communication and making sure you've kind of organized, because when we have a finite time, unfortunately, and it's one of the things I despise the most about my profession, is that we have to go in, see a patient, try to address some major issues, and understand how their disease is impacting their life. And so if we're not able to do that, you got to stop us and tell us, hey, I can't take this med 3 times a day. I've got this, this, and this. And surprisingly, we have strategies sometimes that might get around that. And it's a good way to help us help you.
And lastly, how can patients empower themselves? A lot of them are going through something really scary. They don't know what to do. So what's your advice to them?
I think number one, try to bring someone with you if you can to the visit, because if you do that, then they can maybe help you remember things you didn't hear.
Yes.
Another thing would be, if you want to read, I'm all for education. I think patients and families could be more educated, but I would caution you as to where you get the information. You have to go to a reliable source or ask your doctor. Say, this is just not enough information. I've read this information. These are my questions. Can you help? And oftentimes we can find some better resource for you.
Wonderful. Well, thank you so much for joining us this morning and waking up early with us.
Thank you.
Yeah, be sure to join us online at WNCT.com to view the other live interviews we've had about heart health and what you can do to lower your risk and stay young at heart. The time